So this next video came about because of our clients. So I often teach a pelvic reset. We actually have a video of that where I show it to you laying down on a floor or on a table like our massage tables. But it's been working well for some clients to do seated, whether they've got shoulder issues or it bothers their back to reach, or some of the different limitations of how we demonstrate it laying down. So it's just as easy to do seated. So most clients tend to be forward on their right side. So this is just kind of using our muscles to help bring things back into alignment and gap it so that we can keep things strong and building with both sides of our sacrum and low back in symmetry and in good alignment. So what you're going to want to do, if you're not sure which side you are, you can either do both, it just stretches and moves it, or you can check in with us and we'll let you know. But for right forward, we're going to use those hamstrings to bring that back, and this side to help go forward. So you lift this just a little, resist here, not a lot. Then this leg is pressing down into the floor, almost like if you were going to do a bridge. So it's not a ton of pressure. It's called an isometric. You're just going to hold there for 10 seconds. This hand's not doing anything. And relax. So you don't want to push really hard. You don't want to lean or torque or do something crazy. You're just trying to think about these muscles pulling this side forward and the hamstring pulling this side backward just a little bit. So you're going to hold again 10 seconds. You're going to do that 3 times. Then you can take each of your hands on the outside of the knees, and again you're just going to resist a little bit. So my hands are pressing inward and my legs aren't letting it go inward. So you're just going to hold. Again, 10 seconds. 2 or 3 times with this. So again, I'm not, forcing or going crazy. It's just enough to turn those muscles on a little bit. Again, 3 times, 10 seconds. Then you can either do this, or sometimes a larger gap helps. So again, this is nice. Make sure you can see from the side, make sure that your back's just kind of flat and relaxed. You don't have to arch or anything, but don't just slouch. So you're just going to lean forward at that hip and squeeze those knees together. So again, show you the front view. Lean forward, squeeze the knees together. Again, hold it, feel it build up. You should feel both sets of your adductor muscles squeezing, getting strong. They might even shake a little, that's fine. 10 seconds. Then fists side by side, and the same thing, gently squeeze, build up, almost like you're turning up the dial on a volume. Squeezing. If you hear or feel a tiny little pop, sometimes it's right here, it's just things resetting. Don't be concerned. If for some reason that's painful, give us a call. That doesn't typically happen. So again, you're just going to follow the pattern, pull up, push down, 3 times 10 seconds, pressing outward, resisting the hands, 3 times 10 seconds, then a wide squeeze, a narrow squeeze. Again, that'll just help keep everything in alignment, decrease back pain, pelvic pain, and help you just feel like you're in better alignment to strengthen.